Hello everyone. Here we are going to discuss a small topic that is Raynaud's phenomenon. You usually get a short or very short question on that. So let's start the topic that is Raynaud's phenomenon. Here we are starting Raynaud's phenomenon. So first I will let you know what is Raynaud's phenomenon. Then I will let you know the typical sequence of change in color which is seen in Raynaud's phenomenon. And finally we will see the two types of Raynaud's phenomenon, that is primary and secondary. So you get a short or very short question on that. So let's start Raynaud's phenomenon. So basically Raynaud's phenomenon is episodic pallor of the digits of the hands or the feet. You know the digits of the hands of the feet. Here the artery, the blood supply is the end artery. We know that here the arterial supply is the end artery. Now in some females, in exposure to cold or in exposure to certain emotional changes, frequently in the females, what happens? The arteries, the end arteries over here, they undergo vasospasm. The end artery, they undergo vasospasm. Because there is vasospasm, so the digits become white in color. And this leads to cyanosis. So this is followed by blue digits. And this is followed by, after that, the vasospasm goes automatically. It is relieved. So there is vasodilatation after that. And it will lead to recovery of the blood. And then again, it will become suddenly red. So you can see the sequential change is known as Raynaud's phenomenon. So first, due to vasospasm, it becomes white in color. First, it becomes white in color because of the vasospasm. You can see it become white in color. Then because of cyanosis, it become blue in color. And due to recovery, it become red in color. It is due to exaggerated vasospasm of the end arteries of the digits, that is fingers and toes. Usually it is in the fingers and toes, but occasionally it can occur in the nose, earlobes and lips also. So that is the thing. So learn the sequence of the color. What is the sequence of the color I told you? First there is white color, followed by blue color, followed by red color. Tell me the reason for all three. White color is due to vasoconstriction of the arterioles, vasoconstriction of the capillaries and the arterioles. So vasoconstriction leads to ischemia. Ischemia leads to local syncope, and ischemia and local syncope leads to white color. Now there is the accumulation of deoxygenated blood. There is accumulation. So in response to ischemia, the venules get dilated and the venules contain deoxygenated blood. So there is excess of deoxygenated blood and there is no oxygenated blood because arterioles are constricted. You can see there is vasospasm. So pure blood is not coming and the impure blood get accumulated. That will lead to cyanosis, and because of the cyanosis, there is blue color. After that, the spasm relieved automatically. Automatically, there is relaxation of the vasospasm automatically after few minutes or few seconds. So there is recovery of the blood, and recovery of the blood, it will lead to redness, that is rubor. So three colors are there: white, followed by blue, followed by red. White is due to vasoconstriction of the arterioles and capillaries. The blue is due to cyanosis and red is due to recovery after relief of the vasospasm. Here the vasospasm is relieved. The vasospasm is relieved, again vasodilatation is there. So this is typically seen in the females on exposure to the cold or emotion during primary Raynaud's phenomenon. So the three color changes I already told you. Initially there is white, followed by blue, followed by red. Learn the reason for all three. White is due to diminished blood supply, that is vasospasm or vasoconstriction of the arterioles. Blue is due to prolonged lack of oxygen, there is cyanosis. And red is recovery. When the blood vessel reopen, there is flushing. Sudden, the blood is coming suddenly. You can see there is sudden redness. So first there is white, followed by blue, followed by red. So you can see this is sudden. The blood is coming suddenly. So suddenly it is becoming rubor again, that is redness, due to reestablishment, reopening of the blood vessel. It is of two types. Coming on the types of the Raynaud's phenomenon, it can be primary, it can be secondary. Primary don't have any known cause. It occurs, as I told you, in response to cold, in response to emotions, but secondary have some underlying disease. So the females already have SLE, scleroderma, Berger disease, atherosclerosis. So that is secondary, and they present with Raynaud's phenomenon also. The primary is more common. The secondary is less common. Primary occurs in young age and secondary occurs in relatively middle age or old age. In primary, the symptoms are mild, but in secondary, the symptoms are more serious because there is already some underlying disease. Primary do not require any treatment because no cause is known and it's very mild, but secondary requires the exaggerated treatment of the underlying disease. Here, risk factors are age, gender, climate, family history. Here the risk factor is associated disease. So that's all about it. It may come for a short question. So you have to write what is Raynaud's phenomenon, what are the two types of Raynaud's phenomenon, and write down the sequence of the color change. It's white, followed by blue, followed by red. And you have to write down the reason for each of them. White is due to ischemia, that is local syncope. Blue is due to cyanosis and red is due to recovery. So that's all about it. Thank you.